Today we'll be discussing about jaw relation. Jaw relation, also called as maxillomandibular relation. Definition: it is a spatial relationship of maxilla to the mandible or any one of the infinite relationships of the mandible to the maxilla. Coming to the types, there are three types. First one is orientation relation, second one is vertical relation. In vertical relation, there are two types: vertical relation at rest and vertical relation in occlusion. And third one is horizontal relation. Horizontal relation is of two types. First, centric relation, and second is eccentric relation. These are the instruments which are used for recording jaw relation: rubber ball with water, spirit lamp, jet flame. Ideally, we will use phase bow for recording jaw relation. As UC students, we will use fox plane, wax knife, metal scale, lacron carver, divider, hematoxylin pencil, and hot plate, cotton holder, and thread, which is used for recording triangle line of the jaw relation and maxillomandibular occlusal rims.
Today, let's learn about orientation jaw relation. It is the relationship of maxilla to the base of the cranium. The reference line to be drawn from the ala of the rose to the tragus. It is also called alatragal line and campus plane. We'll check for the lip fullness, buccal fullness, lip length, and visibility. Visibility is fine, and we check for the buccal fullness, lip fullness. We use fox plane as a substitute for face bow. Position the patient and check the fox plane and the reference line whether they are parallel to each other or not. First, let's check on one side. The FH plane and the fox plane should be parallel. And now let's confirm on the other side. It is parallel to each other.
So after the orientation jaw relation, moving on to vertical jaw relation. So what is vertical jaw relation? Vertical jaw relation is defined as the length of the face as determined by the amount of separation of jaws and a specified condition. There are two types: vertical jaw relation at rest and vertical jaw relation at occlusion. Vertical jaw relation at rest is the length of the face when the mandible is at rest position, and the physiologic rest position is the postural position of the mandible of when an individual is resting comfortably in an upright position and associated muscles are in state of minimal contractual activity. Vertical jaw relation or vertical dimension of occlusion is the length of the face when the teeth are in contact in maximum intercuspation. So there are many methods for the vertical dimension at rest. There are facial measurements, and then tactile sense, phonetics. And for the vertical dimension at occlusion, there are most commonly used method is physiologic method. We'll be marking 2 points, that is on the tip of the nose and then prominent portion of the chin. And then we'll be measuring it with the divider from the tip of the nose and to the prominent portion of the chin. Measured in the scale. This is vertical dimension at rest. Then we'll be first placing the maxillary occlusal rim. Tell the patient to look straight. And then we'll be placing the mandibular occlusal rim. Tell the patient to swallow and bite. Ask the patient to bite and measure the 2 points from tip of the nose to the tip of the chin with the divider. This is vertical dimension at occlusion. Coming to the topic of disinfection and effects of vertical jaw relation. Now, effect of increased vertical dimension. The reasons are discomfort to patient, increased risk of trauma, clenching of the teeth. Teeth are liable to contact causing clicking during speech, loss of freeway space, muscular fatigue, clicking sound, and trauma and pain basal seat are areas of the denture, and the generalized hyperemia. Now, effects of decreased vertical dimension, which includes the following: poor aesthetics, angular cheilitis, prognatism, pain in temporomandibular joint, reduced masticatory efficiency, denture look, cheek biting,
and Castone syndrome. So, what is the meaning of the disinfection? It is a process of eliminating or reducing the harmful microorganism from inanimate objects and surfaces, and sterilization in the process of killing or microorganism. There are several methods of sterilization and disinfection, which includes the physical methods: sunlight, drying, moist heat, filtration, radiation, ultrasonic, and sonic. Whereas when it comes to the chemical methods, alcohols, aldehydes, halogens, agents, gases. So let me explain in detail about a few agents. In coming of the physical agents, first is sunlight. In the sunlight, acidic germicidal effect are due to the combined effect of heat rays. Example, tans and ticks. Now hot air oven. The temperature for is 160 degrees Celsius, that is for 1 to 2 hours. So the uses of the hot air oven are as follows: glasswares like the glass syringes, flashes, pipette. So next is moist heat. So moisture, the temperature below 100 degrees Celsius is for the pasteurization of the milk. So temperature at 100 degrees Celsius is boiling and thermalization. So temperature above the 100 degrees Celsius is for autoclave. Autoclave. Autoclave, the steps are: boiling water alone is insufficient to kill the spores or the viruses. Next, which leads to water boils when its vapor's pressure equals to that of the surrounding atmosphere, which leads to ends when pressure increases inside the closed tent, which leads to temperature at which the water boils also increases. The last is saturation theme as the penetration par. So the three factors which affects the autoclave are the pressure, temperature, time, and high temperature and pressure short time for sterilization. So there are three types of the autoclave, that is positive pressure displacement, negative pressure displacement, and combination of both the pressure displacement.
After recording the vertical jaw relation, we'll be recording the horizontal jaw relation. So what is horizontal jaw relation? Horizontal jaw relation is the relationship of the mandible to the maxilla in a horizontal plane, or it is the relationship of the mandible to the maxilla in an anterior-posterior direction. According to GPT-8, a maxillomandibular relationship in which the condyles articulate with the thinnest avascular portion of their respective discs with the complex in the anterior-posterior superior direction against the slopes of the articular eminences. This position is independent of the tooth contact. This position is clinically discernible when the mandible is directed superiorly and anteriorly and restricted to a purely rotary movement upon a transverse horizontal axis. The horizontal jaw relation can be recorded of two types: centric relation and eccentric relation. Under eccentric relation, we have the protrusive relation and the lateral relation.
Now we'll be recording the centric jaw relation. So there are various methods of recording centric jaw relation. What we will be doing here is guiding the mandible. So we will first say the patient to loose the mandible, and we will try to push it as much back as possible. By this we can achieve the centric jaw relation. So as you can see in this, we have already achieved the centric jaw relation. Now we will have to seal both the occlusal rims. How we will be doing this? We will be doing this in the crisscross method. There are other various methods like nick and notch method, but here we will be using the crisscross method. So we will make two cross on both the sides of the jaw. So this way we got the crisscross, and after doing this we will put stapler pins on those crisscross on both the sides. This will help in stabilization of the occlusal rims. As you can see, it's done. Now after this we will be drawing the midline. So for the midline, we will have to take from labial frenum of the maxilla to the labial frenum of the mandible. We will see both the frenum and we will mark a line straight from one frenum to the other. This will give us the midline. After that, coming to the canine line, this we will mark on both the sides. We will take ala of the nose as the reference point, and straight from there we will be marking the canine line on both the sides. As you can see, this is done in this way. At last we will be drawing the smile line. We will say this patient to smile, and we will be drawing this line.
Anterior teeth selection for edentulous patients. The form, size, and color of artificial teeth should be determined based on certain guidelines, like pre-extraction records, diagnostic cast of natural teeth, extracted tooth, photographs, radiographs, teeth of the close relatives. Diagnostic cast and extracted teeth are more reliable guidelines to determine the size and form of anterior teeth. Size of teeth should be proportional to the size of face and head, and women's teeth will be smaller than men and should look more delicate. Other guidelines: parallel lines from lateral surface of ala of the nose determine position of the apex of the canine, and if we mark the corners of the mouth on the occlusal rim, the distance between them give the width of the 6 anterior teeth. Form of anterior teeth should be harmony with patient face, like outline of the face may be square, tapering, or ovoid. The labial surface of the tooth viewed from mesial aspect show a contour similar to that of the face viewed from the profile. Dentogenic concept states that teeth should be selected based on age, sex, and personality of the patient. Example: squareness of the tooth gives masculinity. Rounded incisal and proximal contours give femininity. Color of the tooth. Color should be compatible with patient's facial coloration. The color selected should be inconspicuous that will not attract attention. Color has 4 qualities: hue, saturation, brilliance, translucency. Hue, saturation, and brilliance of the teeth should be in harmony with the coloration of face. Translucency, which is property of enamel, make possible some variation in the effect of the color with different lip and mouth positions. As age increases, teeth becomes darker, so darker tooth are preferred for old patients compared to young ones. For selecting the color of anterior teeth clinically by observation, the shade in 3 different positions: outside the mouth, along the side of the nose, under the lips with only incisal edge exposed, under the lips with only cervical part covered. The intercanine distance, parallel lines from the lateral surface of the ala of the nose. Shade selection: by placing the tooth adjacent to the nose.